Welcome to Unloading, a community podcast focused on illuminating the diverse perspectives across the country about solutions to the epidemic of gun violence. I'm Kate, a fourth-year medical student from the University of Colorado.
I'm Mijo, also fourth-year medical student from the University of Colorado.
Our hope is that these stories will inspire you to learn more about gun violence and take action in your own community. Hello all, thank you so much for coming. We have several medical students across the country here with us today.
My name is Sarah, and I'm a third-year student at St. George's University.
I'm Kat Jeffries. I'm a first-year medical student at Rush in Chicago.
I'm Claire Jacobson. I'm a third-year medical student at University of Colorado School of Medicine.
I'm Drew. I'm a fourth-year med student at Wayne State University in Detroit, Michigan.
I'm Susan Musili. I'm a third-year medical student from Pikeville, Kentucky.
Thank you guys all again for joining us. We were wondering if you could tell us about how you first got interested in firearm prevention and injury.
So I got firstly involved kind of back in your middle school and high school, as most of us kind of growing up in a gun violence era. We had safety drills in which they'd put the whole school on lockdown. And of course, when we're like in elementary, middle school, we don't think much of it. So we're like, this is just all false reality. It's not really occurring. And then one time for me, it was no longer a drill. It was an actual gun violence that we had in my middle school that was attached to our high school. And one of the high schoolers came in with a gun and shot a few teachers and students. And that was the first time it really sunk in for me that this is a reality. And luckily, we had just done a drill a few weeks prior to this incident. I just remember sitting in my classroom. The teacher had us all in the corner. No one knew what was going on. We didn't have our cell phones. And it was just, to me, it was like, I don't want any other child to have to go through that. And unfortunately, we're just seeing it more and more often. And that really pushed me to get more involved.
Thank you for sharing, Sarah. I grew up in St. Louis, which has a very high rate of gun violence. So I grew up knowing gun violence was a thing, but I didn't really feel the impact of gun violence until in 2021, my sister, niece, and nephew were murdered by her husband. It was a domestic violence incident, and it was a series of escalation of events. But even though the events were escalating, I still never thought that he would end up taking their lives. So obviously, it was very impactful on my family, very traumatic. And I was hurting, and I decided that I needed to bring awareness to the issue in an area that I knew something about. So as the assistant director of AMWA, I had connections to a lot of medical schools and medical students across the country, a lot of healthcare professionals. And so I partnered with, at the time, we were called the Gun Violence Prevention Committee of AMWA. And I made this podcast that we're now on, and we decided to work from the curriculum angle on addressing gun violence curricula in medical schools.
I did my clerkship year at Denver Health, which is, for those unfamiliar with the Denver area, it's kind of our safety net county hospital, and had the privilege of taking care of a few patients, especially on my pediatrics rotations, who were deeply impacted by firearm injuries. And at that time, I got to know an attending who I worked with on internal medicine, who was piloting a program of distributing lockboxes and promoting safe firearm storage at Denver Health. And so through her, I got involved with that initiative, and I'm now doing a lot of research with the Firearm Injury Prevention Committee at Denver Health, looking at who's coming back to the emergency department following firearm injuries and more the firearm injury post-discharge care aspect, so a little bit different.
I grew up in India for the first 13 years of my life, and that being a developing country, I would assume stuff like this I've heard more there, which my exposure to gun violence while I was in India is like almost sub-zero. But once I came here, I think during that era, through my undergraduate and even med school, like the amount of stories that I keep on hearing is just unfathomable to me. So I think from my exposure to it, it's just hearing that there is a pandemic other than COVID-19 that is happening in the United States, which is actually preventable, unfortunately.
The thing that kind of motivated me to get involved more was my 18-month-old had a lockdown at her daycare. They were across the street from a school, and the school had some threats, and there was a person who brought a firearm onto the school's property. And so it wasn't a direct threat to their daycare, but the whole time I'm just screaming inside of my head, like, they're toddlers, how do you protect toddlers from firearms as teachers and as a parent? And it's just, Hearing just guttural sounds of a mother learning that she's lost her child is something that I just don't want to ever have to experience. But knowing that being in the healthcare field and knowing that we're going into that, that's what we're going to experience, especially as the previous speaker said, it is a very American dynamic. And I started getting involved in Moms Demand Action. And then once the opportunity came up to participate in AMWA's Gun Violence Solution, I really looked forward to that opportunity to try to become more organized in my efforts to promote responsible gun ownership and promote safety and injury prevention.
Thank you all so much for sharing. For those of you who've worked in the clinical setting so far, have you had a chance to discuss firearm prevention and injury, either with your colleagues or your patients? And if so, how did that go?
Fortunately, I did not have to deal with any overt gunshot violence cases in my clinical setting. But one thing my school does great, and they kind of drilled it into us in the first 2 years when we were doing clinical skills and simulation patient practices, is every time you go into the room, they kind of pseudo required us to ask the question about guns and locking up the guns. But at the same time, they were careful enough not to offend the people who own guns or anything. They kind of taught us in a way that, okay, it's okay if you have a gun, just make sure it's locked up. And actually, in a clinical setting where I got across it, especially when I was in pediatrics, I think my attending told us to ask this question if they had a gun, because kids are involved, like make sure if they have a gun, just ask them or passively nudge them to keep it locked up. Don't ostracize them that they own a gun. There is nothing wrong legally, and I guess even morally. Just owning a gun, just make sure you're careful with it.
I'll have to say that at least your university was kind of giving you some pointers on how to deal with that. Because I know probably for a lot of us, we don't get that in medical school. At least my medical school didn't even mention once gun violence, how to address it in a clinical setting, what we might even expect to see when we go through our ER rotations or PEDS rotations. I go in expecting that at some point I will see it, but my university, and I bet a lot of other universities, medical schools, even high schools and things like that, don't prepare us for how we can face this in real life. And being that way, I took it upon myself to kind of learn. And with the different organization, I found a class that actually taught you about gun violence in the hospitals that we may experience through like your hospital violence intervention programs. And that to me was very impactful to learn, like, hey, there are people out there that are willing to help the hospitals to figure out patient comes in with a gunshot wound. How do we do the trauma-informed care cycle to help prevent this patient from re-entering the hospital in 2 more weeks with another gunshot wound? And so that class over how these intervention programs work and how us as a medical student going into this clinical setting can actually work with those programs to help decrease gun violence in the community, prevent re-injury, and get these people back on track to have a well-supported life. It was an amazing class to take. And after doing that, I really wish our universities would put into effect some sort of program like that.
Do you guys feel like in your medical education that there were certain ways that the school was able to help you practice, like working about those conversations or handling the emotions?
It's so specific as to the clinicians that you work with. Like my pediatrics preceptor last year had me like add asking about firearm injuries to the well child check. After I asked about helmets and seatbelts, I would ask about firearm injuries. And that's an example of, the perfect way to weave together an automated part of your routine screening. But of course, that was not something that I was taught in a class or that was standard hospital policy. That's just one motivated, passionate individual. So I think any avenue that we can take to have more standardized screening, trainings, medical student education is obviously preferred.
I'm involved in the curriculum at Rush, and I've talked to upperclassmen. And as far as I've been able to suss out, we do not get very comprehensive or even really a thorough mentioning of how to talk to our patients about guns in their home or having previously experienced gun violence or gun safety. And it's interesting because I do consider the Rush's curriculum to be very thorough in a lot of aspects when talking to patients about illicit drug use or addiction or managing how to talk to patients about the difficult emotions that they're experiencing. But this is something that is currently not included in our curriculum.
It is a missed opportunity. I feel like that we could focus more on a public health approach, or even just recognizing the mechanism of injury is often guns, and saying like having access to guns does increase their risk of completion of suicide, and being more direct on that versus just saying the majority of suicides are caused by firearms. And I think it's the wording and the way that it's presented to students to recognize like this is a public health problem. A lot of schools have a missed opportunity on that. It's interesting to hear from students from all over the country, because my pediatrics rotation, I felt like did a really fantastic job of bringing that into well child check and making it as normalized as wearing a helmet. Normalizing it and reaching it to a point of safety as you would anything else, I think is going to be a way that you garner patients' involvement versus seeing patients who've had injuries related to gunshot wounds and immediately criminalizing them, immediately making them into like, oh, why did you let yourself get into that situation?
I think Susan, Claire, you guys both brought up something I think that was really interesting, where Susan, you said that in your pediatrics rotation, it was really normalized to bring up firearms and kind of going through that screening process. While Claire, you mentioned might be more of like a doctor's individual preference. And I guess I'm wondering, Susan, like, do you think your preceptors did at that hospital that made it feel like so much more natural part of the conversation to help prepare you for those kinds of conversations?
I think it's just like anything else, talking to children and talking to other people is just, it's only weird if you make it weird. And so she just very much kind of made it into a conversational approach, like, hey, do you have any firearms in your home? And if they said yes, like, okay, because this person is toddler, is this age, they're climbing, or, and just normalizing this is a behavior. So this child may have access to it. And then even oftentimes like teenagers would say things like understanding that because your child has had some concerns with, anxiety and depression, having access to firearms is a safety concern. But I think the thing that they did that was the most effective was that they built a trust, also just said very matter-of-factly. This is not a conversation up for debate. This is just having access to firearms or having access to unsecured weapons can increase the risk of injury.
Yeah, that sounds like excellent role modeling for sure. I think whenever you have a preceptor who can help the conversations feel natural and show an example to us as students, that can really help us learn what we can say and how we can phrase things. And I think it's interesting, we've mentioned a lot of pediatrics and that kind of being the common theme where we bring up firearms and bring up that screening, but have there been other rotations which you guys saw that sort of discussion take place?
Not for me. Even for wellness exams for outpatient adults, I did not see that, which is interesting because even like the geriatric population, can be injured by gun violence.
I think for me, family medicine was one of the places where I found myself asking the question, not normally, but if I had patient come in and say, oh, I went hunting this weekend, or I went shot at a range with some of my buddies, I just found myself asking, oh, hope it was a good time, but you have a gun locker in your house. Are you keeping this locked up? Asking them in a non-judgmental way, and never had an actual patient be offended when I asked those questions, which I think is a great thing. Just going back to the previous question, I think one way my school prepared me for the uncomfortable conversations when it actually gets uncomfortable is we had a couple standardized patients when we went in and asked the question, hey, do you have guns? In my pre-clerkship years, first and second year, I actually had a couple of patients like kind of be weirded out by the question, like attack me back saying that, do you think I'm a bad person if I own a gun? Like, why are you asking me this question? And I was like, I think going forward, if it's not happening in rotations, I think schools actually involving that in the simulation centers, I think would be a great way to prepare students when someone actually gets offended by you asking the uncomfortable question, be it guns, be it about sexual activity, be it about absolutely anything else.
Can you tell us a little bit what a standardized patient is?
Yeah, so standardized patient is basically actors that act as patients when we're training in our first 2 years of medical school, where you don't probably have a chance in many medical schools to go and actually interact with real patients. You actually get some kind of exposure, however simulated it is, to learn and practice how to interact with real patients so that you are not completely caught off guard in your clinical years in third and fourth year.
I think it's great that your school gave you that opportunity with a standardized patient to practice the concept of gun violence. We're always taught about like addiction, diseases, how to approach patients. And I've had many standardized patients, even with those hard interactions of like HIV or drug abuse. And we're really taught really well how to handle those. But then when we come to this other public health topic of gun violence, it goes unnoticed. And so I really love that your school was able to help you get that started. So at least when you do experience it, you'll have some foundation to go off of.
At our school, we do like longitudinal integrated clerkships. So you're at one site for your entire year. And the Denver Health cohort, we actually did a training for them this year on how to talk to patients about firearm injuries. This is like the first year we've done that. But it's also unique because the hospital got a grant in all the primary care clinics. So if you screen someone and they say, I do have firearms in the house and I'm interested in safe storage, we have the physical lock boxes there in the clinic and can give them to them right there. So it's really special, but we're working on next year doing it for all upcoming clerkship students, just to practice these conversations before they happen. The attending Dr. Ann Drabkin, who I work with at Denver Health, she was very motivated because she felt like on the provider side that residents, attendings, nursing staff, like basically all hospital staff were underprepared at such a high prevalence of firearm injuries hospital. And so they started doing all staff trainings. They started kind of at highest yield, like a lot of our outpatient psych providers, emergency department providers. And she also offered like, maybe this would be helpful for medical students. And we have weekly didactics. So I was able to sneak in there and do that. But yeah, it's basically like a 45-minute talk explaining about the epidemiology of firearm injuries, prevention statistics about providing safe storage, how the safe storage works in different forms of safe storage. And then we have time to talk about how you initiate those conversations, tips like you all talked about for normalizing. I ask all my patients about blah, 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 and troubleshooting different tense conversations. And usually students bring up a lot of their own personal stories during that time of conversations they've had, and that's always a really rich discussion. But yeah, that's sort of the program that I've been helping with. And I gave one other lecture to some psych outpatient providers, but the rest of it's been done by other like attendings on the committee who are doing awesome work on the provider side. And the other thing I wanted to add, because I feel like someone out there is in psychiatry and is upset that they didn't get mentioned, I think psychiatry does a great job of bringing up firearms as well, especially when it comes to like safety planning and stuff. Love you psychiatrists out there.
Claire, that is an amazing program. One of the things that I'm doing is helping out with the American Medical Women's Association with the Gun Violence Initiative, figuring out how to help fix this, because at least with a big organization behind you, you're able to make waves. And I think that's something that we as medical students really struggle with, is we have all these ideas and all these things that we want to do, but without the support from bigger companies or our physicians, there's nowhere that we can actually get it done. And that leads me back to thinking earlier, Susan, you mentioned that you were involved with the moms group. I want to learn more about that, because that sounded like it could actually make some major changes in this playing field.
Absolutely. So Moms Demand Action is a national organization that is kind of similar to what had occurred in, I think, probably the 70s or 80s of like Mothers Against Drunk Driving. So basically, it's a lot of moms have gotten together, and I kind of got involved a little bit with my local chapter. Like we went to their march and their firearm injury violence day, but they do a lot of like advocacy days at the state level. And I think it speaks to the volumes of what moms can accomplish when they organize.
All you guys are a part of some really incredible things and changes happening. I think this was the first year that the White House had the Department of Gun Violence and Solutions department in its first creation. And so I think we are seeing a really big change, and I think that the future looks bright in terms of gun violence and injury and public health. Thank you for listening to Unloading, a community solutions podcast for gun violence. This podcast is in part of the American Women's Association Gun Violence Task Force.